2020 has been a year of the unknowns. Tonight we focus on how the usual year-end festivities have been affected by COVID-19. The tourism, entertainment and travel sectors have been hit the hardest. The virus brought with it many changes and prohibitions to how business is conducted. And following health protocols while creating festive cheers has been a tough call. It's even a tougher time for those who suffer from mental illness, as according to mental health experts, they usually feel isolated at the time of this year. Good evening, I'm Aldrin St-Pierre, and this is Unfiltered. Our guest this evening will be joined a bit later on by Sisan Jona, who's the Chief Executive Officer at SA Tourism. We'll also be joined by clinical psychologist Samkelesiwe Mthembu, as well as Professor Mariki Venter, who is the head of Zoonotic Abo at Respiratory and Virus Research Program at the University of Pretoria. And remember that you can be part of this discussion going through our social media platforms using the hashtag SABC Unfiltered. And let's start off the conversation by introducing Samkelesiwe Mthembu. Good evening and welcome to Unfiltered. Let's start off here. Obviously, the festive season comes with very festive cheers. However, though, this time around, it has been dampened. Hi, Samkelesiwe, can you hear me?
Yeah, sorry, you cut off there for a moment.
Sure. I just wanted you to touch on how ordinarily a festive season would be all about the cheers and the festivities. However, though, this time around, it has been dampened by COVID-19.
Well, I'd first of all like to start off the ones that have actually lost family members due to COVID. So they're obviously still in a time of grieving, still in a time of dealing with loss. And usually, this time of year is when the family gets together and, celebrates family and seeing relatives you haven't seen in a long time. But for some, it's going to be a difficult festive season, knowing that they've actually lost some people due to COVID. And then there's the added responsibility or the added stress of the fact that finances aren't as they were supposed to be. People have lost out on their bonuses. People have lost their jobs. There's also then the COVID itself that's actually still in around, even though we are, we've lessened in terms of stages. We are still very much at risk of the COVID, and simple things like giving your family member a hug or a kiss or a touch, and then there's that added fear of what if, especially if it's an elderly person, there's that fear of infecting your family member with COVID, or especially if they're older, and sitting with that guilt and this sense of anxiety where it takes away from the festive cheer.
Mm-hmm. So you speak about guilt and also that sense of anxiety that's there. And then, of course, you have the elderly in the family. And for us in South Africa, sometimes when it comes to the festive season, you go back home. Uyobona ugogo, uyobona umkhulu. However, though, this time around, things could be quite different because different things are expected of people to make sure that they adhere to the protocols of COVID-19.
Yeah, it's very, very difficult because, COVID has not only changed the way we respond to, our environment, but to each other. And it's this time of year where, physical touch or just seeing a family member that you haven't seen, or even a family member that might be sickly, not even due to COVID, because it's not just COVID that we need to worry about. And then there's that guilt of, okay, what if they're sick and then I add on, something else? Or what if I come and I bring COVID? So, then, it goes back to the main, the topic that we're talking about, isolation. Those who are so used to isolating themselves are even further isolated now because of the COVID and the way things are happening, and also the fear of spreading COVID, especially if you're in a high-risk zone, or if you have come in contact, or there's just that general fear, whether because you never really know if you're touching somewhere where someone could have been. So I think the fear intensifies the anxiety. I think also the lack of I can say physical presence of people intensifies the depression, and therefore also intensifies the risks, or one risks to suicide. And it's a very difficult time for some people to be experiencing.
You speak about suicide, and the thing that comes to mind is the survivor's guilt. Those who survive and somebody else may have committed suicide. And I want to juxtapose that to COVID-19, that I may have been infected with COVID-19 and I have recovered successfully. However, though I know a family member, a friend, or a colleague perhaps who hasn't survived, what happens during that time?
Well, I mean, there two things could happen is sometimes when you survive, you actually suffer from more trauma than if you didn't, because there's that thought in the background, I could have died. Especially those, I've had clients explain to me what it's like being in a COVID ward where, or even not, let's say you're in hospital for something completely different. Let's say you broke your ankle or something happened and you enter into the hospital, but your family can't see you. And that stress of not knowing either what happened or what's going to happen next. And even when you're out of the hospital, there's that sense of I could have died and I've experienced loss. It's like loss on top of loss. And it's quite stressful, and it does lead to one feeling depressed and the risk for suicide as well.
What are some of your clients then telling you about this period for them, especially those who may have come in contact with somebody who is COVID-19 positive or may have succumbed as well?
I think fear is the biggest one. Fear and just knowing how close you could have been to death. And not only that, but experiencing loss, funerals, and also fear around funerals, spreading extra COVID and infecting someone else. So there's just this sense of uncertainty where each time, as South African citizens, we're trying to put our feet on the ground, whether if it's going from each stage, to also then still having to wear masks, where there's that added fear, there's this intensity in the air of at any moment it could be you, or if it was your sibling or your relative. Now it's a matter of how do I move on, but also still prepare for not getting it or making sure my children don't get it. So it's a very anxiety-provoking thing that we have to deal with, especially during the festive, where it's the time of year where people do tend to relax and spend time with the family. There's also, the people who are thinking about their school children. There's their children and school. Things like, what they've missed out on, or when they're meeting with family, the question of the social clock. What have you done this year? What have you achieved? When are you getting married? For those who had to postpone their weddings. So there's a deep sense of loss and fear that is in the air when it comes to patients, and I assume a lot of South Africans are experiencing, and it does really contribute to certain aspects of mental health.
Yep. Okay, so remember that you can be part of this conversation by going on to our social media pages using the hashtag SABC Unfiltered. That is hashtag SABC Unfiltered. Tell us about how you've experienced the couple of days of the festive season so far, and how it had an impact on the festivities around your family unit. But when we come back, we're going to have a conversation about how do you uplift the mood in the family during this difficult time. And welcome back to Unfiltered with me, Aldrin Simpier. So next we'll be in conversation with Professor Mariki Venter, who's the head of the Zoonotic Arbor and Respiratory Virus Research Program at the University of Pretoria. And then a bit later on, we'll be in touch again with Samkile Siwe to try and find out from her what exactly it is that the family can do during this difficult time to make sure that the festive mood is not dampened that much. Prof, good evening and welcome to Unfiltered. Just looking into the numbers that have been recorded so far and also the alarm that has been raised by the President, what's your take on where South Africa stands at the moment?
Good afternoon. Yes, I think that South Africa was at quite a good place, but that we are at risk now to see an increase in cases again. So the Eastern Cape is definitely a worry, and the Western Cape and all of the Garden route that have increased is also concerning. So although Gauteng was looking better, I think that we should definitely be aware and take care that we don't all go the same route. So the risk of the super spreader events that recently took place in KwaZulu-Natal is, of course, something that is of major concern for all of us, and that's definitely something that can spread the virus again across the country.
Mhm. Let's just quickly touch on the Eastern Cape as well as the Garden Route, which has been emphasized by the President as well. This is Nelson Mandela Bay and the Garden Route, Sarah Baartman municipality as well. Is it clear as yet that what may have led to those increased numbers that we saw, leading the President to even taking the decision that Nelson Mandela Bay would specifically have its own restrictions?
Well, I think it would be difficult for me to say exactly what was the reason for that. But if you go and look at the numbers, they are significantly higher than the rest of the country. So if you look at per 100,000, there's over 200 to 300 per 100,000 cases there at the moment, while in Gauteng it's still quite low and under 100,000, under 100 per 100,000 cases. So I think that the initial increase that basically then just amplified itself, mainly because people probably didn't take care. There's been more events where people crowd together. If we don't take care of social distancing, continuing wearing our masks and so on, this is definitely something that will happen. So as soon as you get more cases in hospitals, you get more cases in healthcare workers, and then the families are also exposed. Remember, many cases of COVID-19 is asymptomatic, so you wouldn't know, especially young people, if they are sick, may come into contact with older people and then spread the virus that way.
Mm-hmm. And this also comes during a time of the festive season where people actually go back home or go to the rural areas where some of them are from. What is it that you would say that municipalities and probably local leaders should be taking into consideration during this time, including those who would be on the road?
Well, I think all of us need to remember that during the festive season, there definitely is now more traveling than what we had before. People are crossing borders and going to different provinces. And, of course, the Garden Route in the Western Cape is at more risk because it is a tourist destination and they will have more visitors. But those people will then go back to their provinces, return to where they come from again. So I think it's still very important for us to avoid large crowds. Don't go to events where there's many people that in close proximity to each other. If we're going to have any gatherings, it needs to be outside and still restricted to a low number of people. So if you're going to have visits with your family, restrict it to the lowest number of people and make sure that you don't crowd inside. And wear your mask everything is still in place of washing your hands and remain or keeping a good social distance.
Yeah. So what we saw during the initial lockdown and the hard lockdown was that there were roadblocks that were set up on various main routes, including highways as well, and trying to test and try to see how many people have COVID-19 and prevent them from spreading the virus. Is that something at all that we should be considering?
I personally don't think that type of testing helps us a lot. I think that South Africa has a limited amount of tests available to us, and that we definitely do better by actually testing people that are sick and to trace specific contacts. So if someone has been exposed to someone that is actually tested positive for COVID-19, those are people that can either then do self-quarantine or be tested before they are allowed back to work. And especially if they show any clinical signs, any respiratory signs after being exposed to someone with COVID. I don't necessarily think by testing many people on the road that will help, although definitely contact tracing of people that were exposed, that is important. So remember, because many people are asymptomatic, this virus is quite different than what it was to do contact tracing in a situation like Ebola, for example, where you could actually see who are sick. So in this case, it's much harder. Many people will be exposed and travel around that we don't know are symptomatic. But we still have to make sure that we have the capacity to test sick people and to ensure that people around hospitals get the proper testing that they require. So anyone that's been tested positive, been hospitalized and so on, it's their family really and their direct contacts that should be tested.
Speaking about contact tracing, earlier on this year, the President announced the app that will be used to help with the contact tracing. Is it clear as yet whether that app has been helpful at all?
I cannot really comment on that. I haven't seen any data that the app has been used in such a way that that we've identified additional contacts that's been traced that way. But this is simply because I'm not sure. I know in my personal workplace we use the app constantly, so you have to fill out the app every single day to show that you actually had exposure or not, or if you are sick. So definitely just in that way of making people more aware of reporting any symptoms, and if they do come up with symptoms, to make sure that they isolate themselves and don't expose any further further people at work or in a holiday situation. That will definitely help.
Well, it is the festive season indeed, and when we come back, we're going to touch a bit on tourism, because tourism, of course, playing a big part to building South Africa's economy and also the recovery of the economy as well. On the other end, you also have the health facilities, and the question being asked is whether those health facilities would be ready to take in an influx of people should the second wave actually hit the country. And welcome back to Unfiltered with me, Aldrin Simpier. We're focusing on the COVID-19 and how it has had an impact on various industries, including the tourism industry. But right now we're focusing on whether the health facilities, including the hospitals, will be able to respond to the influx of people who would be moving to various provinces. And we're joined by Professor Mariki. Professor, if you could just come up again. And the question that I had earlier on was around the facilities, the health facilities themselves, that initially the health facilities were put in place to respond to the population of that province. However, though, with the people moving around, is there clear indication whether these provinces will be able to handle these number of people if there is an increase, an upsurge in the number of COVID-19 cases?
Well, the health facilities have obviously been increased in order to be able to deal with COVID. I don't have personal knowledge about each of them in the different provinces. But what I can say is that when COVID started, most hospitals was not really prepared because we didn't know how to deal with this virus. So I think they are much more prepared at the moment. However, we always have the concern that the COVID cases can overwhelm the hospital and that you actually then don't have the capacity to deal with normal emergency cases or normal clinical cases. So it remains very important that we control the number of cases that are admitted to the healthcare facilities.
Mm-hmm. What would your advice then be to somebody who may be facing, who may have mild symptoms of COVID-19 or may not even have any severe symptoms of COVID-19, and just taking into consideration whether or not hospitals will be able to deal with the influx of COVID-19 patients should there be an upsurge?
I think we've already heard that there's people that's been shown away from some hospitals, so it is really concerning if older patients or patients that are at high risk are unable to get the care that they need. So if people have no or minor symptoms, it still remains important that they self-isolate and that we don't then end up with more cases because they expose others. But of course, not all COVID cases would need clinical care. But anyone that do experience any of the more severe signs need to find clinical help or medical help.
Okay, let's just say goodbye to our SABC 3 viewers, but the conversation continues on the SABC News channel on channel 404. And welcome back. As we've indicated, we're in conversation with Professor Mariki Venter, who's the head of Zoonotic Arbor and Respiratory Virus Research Program at the University of Pretoria. We're now also joined by Sisan Jona, who is the Chief Executive Officer of SA Tourism. Mr. Njona, good evening and welcome to Unfiltered. Just listening into what the Prof had to say there earlier on around the health facilities themselves being able to respond to an upsurge of COVID-19 cases. And I guess that is one guarantee that SA Tourism would have to give some of our potential tourists who would be coming through to the country, or even internal tourists.
Yeah, absolutely. Thank you very much for having me over, Alvin. Tourism sector is, severely hit by the pandemic. It is still ongoing. It's been a long, hard couple of months, but I think as the world starts to figure out itself, in terms of managing the pandemic, looking at both tourist, international and domestic as well, it is still a very fluid environment. And I think the more that we learn and get new data points over time, we adjust ourselves and our strategies as well.
Are you satisfied with the health facilities themselves? This is now speaking about the hospitals and whether or not they have the capacity to respond to an upsurge.
Yeah, as I said earlier on, this is a global phenomenon. And our priority is obviously to the lives of South African citizens and also to visitors that may be coming in from abroad as well. The first line of defense is always primary care, which is prevention. And, in our campaigns all the time of encouraging people to travel, but to do it safely. We have implemented health and safety protocols right across all tourism activities, from wearing masks, sanitizing, social distancing, so that all of the entire kind of value chain of tourism can also be proactive within that space as well. So it is really about informing and educating the traveler to make sure that they know what to demand when they arrive at tourism establishments, but more importantly as well, about protecting themselves as they embark on their journeys across the country.
Mm-hmm. So when we decided to open up the country slowly and allowing various routes that flights can fly through from, one of the issues that was raised was around the testing, the COVID-19 testing that will be happening once a tourist or a visitor lands at an international airport. Has that issue been sorted out around who would be bearing the cost?
Yeah, absolutely. So I must provide context that no country in the world has this right. Everyone is scrambling around to find whatever regime that works for them. And part of the challenge is that because there's no uniformity, you can then imagine as a traveler, you have to conform to all of these regulations as you move from country to country. South Africa has tried to make it as simple as possible. And all it is that we require, is a negative PCR test on arrival at any port of entry, not older than 72 hours. The cost of these, like the cost of visas or anything else, is always borne by the traveler themselves. So therefore, they will have to engage in these services from their country of origin, make sure when they arrive at the borders that they actually have the negative PCR tests.
Okay, remember that you can be part of the conversation by going onto our social media pages using the hashtag SABC Unfiltered. Tell us about your experience so far traveling around the country with a few days into the festive season. What has it been like? And also looking into some of the protocols that have been set up. Do you find that the places that you've been visiting at all, that they have been following these protocols to the T? The conversation continues just after this. And welcome back to Unfiltered as we focus on the impact COVID-19 has had on various industries. This evening we're focusing on the tourism sector, and right now we're in conversation with Tourism SA CEO Sisa Njona. Sisa, looking at the impact COVID-19 has had on the tourism sector since the initial lockdown in, April. What would you say the impact has been on the industry? I remember there was a report that was released by the United Nations saying that over I think it was 150 million jobs, if I'm not mistaken, that were on the line.
It's absolutely devastating. In South Africa, tourism contributes about 8% to our GDP. 1.5 million people are employed in the sector as well. And came 26 March, tourism was not, labeled as a priority and essential service. So we had to close down all operations. The sector's been hit hard. And a global phenomenon, is that at its peak, I think in May, 90% of global airlines were actually grounded. So there was no movement at all. We've estimated that it's going to take us about 2.5 years just to restore back to 2019 levels of activity. So the recovery is going to be slow, it's going to be painful, but inch by inch, I suppose, as we get more concessions of opening up and engaging, with our tourism and travel partners, things will get better, but it's going to take some time.
Is there any indication at this point how it has affected the job market?
Well, yeah, I mean, look, a lot of people employed in the sector have either been furloughed or literally, been let go of. And again, it's all about the activity. The more or less activity there is there, the less people that are required from it. We've seen, however, a great resurgence from domestic tourism because we've always felt that the recovery will be led inside out, starting off with domestic, then regional, then ultimately international. And it's all about, confidence levels of travelers, that people will explore the immediate surrounds first. And the more confident and comfortable they get, the circle gets wider and wider. And as South Africa at the moment, we are in that sweet spot of domestic tourism really picking up and starting to plug in that hole that has been left by, the hard lockdown.
Mm-hmm. Is this because of the price packages that have also changed to try and make it more, more enticing?
Yeah, it's all of the above. I think, first of all, it's pent-up demand. I think, after a couple of months being locked indoors, we want to explore out. To give you a bit of a sense, when the president announced that domestic tourism or domestic travel is allowed interprovincial, the Sandparks website for bookings just literally crashed because there was such a high and peak in demand. The sector as well is also reviewing its pricing and making it relevant for the market and audience at this point in time. For the foreseeable future, we are going to get flat activity from international markets, so they have to look inward and therefore have to adjust the value proposition in order to be relevant for the domestic market.
Mm-hmm. How difficult is it, though, selling the country, even to its own domestic tourists, when it comes to COVID-19? Because you think that there would be those anxieties that people still have around traveling. And now the announcement also that the speech from the president looking at what's happening on the Garden route as well as Nelson Mandela Bay.
Absolutely. It would be irresponsible for any agency such as ourselves to promote people to travel without really giving them the tools and the cautionary in terms of how to travel. And to me, it all starts with health and safety protocols. You have to prepare the environment first and make sure that the sector is ready to welcome visitors. And they themselves have implemented all the health and safety protocols, before they open, so that as they accept guests, the guests know exactly what to expect and also what to demand. And the guests have full right to actually walk away from any establishments, be accommodation, be it restaurants or whatever it is, if they feel that that particular establishment is not following the protocols. I mean, that is something that we impress is in the consumer, is in the tourist, is in the traveler, essentially, to make informed decisions as they travel across the country.
Will I be reimbursed if I get to a hotel and I feel like they don't follow the protocols and I want to check out?
Well, each hotel at the moment has got its own kind of regime that is there. And I would advise everyone to really look at the terms of conditions of each, establishment that they choose to visit beforehand in order to understand all the terms and conditions. There is also recourse for all, travelers who don't find, either the protocols being followed, etc. from that regard. And there is a travel ombudsman through the Department of Tourism that is essentially established to do just that.
Mm-hmm. And what steps is it that we can take?
Okay, so within the department, I just don't have the details with me, but if you go to the website, www.tourism.gov.za, there is an area there about the Ombudsman of Tourism, and you're able to lodge a complaint basically from there, either electronically or even with telephonically with them as well. And they will pick it up and make sure that any consequence management follows through if any.
Okay, let's then just quickly touch on the businesses themselves and those who are in the business of tourism. So earlier on this year, we heard a report indicating that at least three out of four businesses, SMMEs, said that they won't survive COVID-19. And I'd assume that some of those people are your constituents who are in the tourism sector.
Absolutely. Which each month that was going by under hard lockdown, that the businesses were not allowed to operate, we get what you call a supply deterioration, basically meaning the ability of many businesses to keep the doors open with zero revenue coming through, but an expense line was really, really tightened. So we will definitely see some businesses fall off and not be able to recover. Even in the recovery space as well, there's still some businesses that essentially just will not hit those targets, in being able to hold sustainably as well. What we're seeing right now is that most establishments or activities in tourism that are either have a beach or a mountain, or even a bush are quite popular with leisure tourism, basically. People going out there on weekends and also on weekdays, what we see now. The areas that are really under pressure at the moment are the inner city hotels that typically are targeting corporate travelers, government, and also conferencing. And we've seen that space. The movement has really, really been flat in that space. So that part is quite soft. And we've seen businesses that are struggling there. Some hotels have not even opened, are waiting for better activities. So it's going to be a slow recovery.
Okay. Let's just quickly go to this break. When we come back, we conclude our conversation looking into the tourism sector and also some advice, at least, if you are one of those people who are in the tourism sector, what exactly it is that you can do to try and attract more clients. And welcome back. We're in conversation with Sisan Jona, SA Tourism CEO. And then a bit later on as well, we'll give you some tips around how you and your family can try and make sure that the festive season is not as damp as some may expect it to be due to COVID-19. But first of all, Sisa, some advice that you can give some of those people in the industry who are struggling. What is it that they can do?
Yeah. It is all about really being agile and understanding the changing needs of the customer, that health and safety is a priority for them. Value proposition, right pricing is important as well. And I think once you get that kind of balance in place, you have a better chance of actually making sure that you can trade in a much better space. The consumer behavior is changing all the time as people get new data points, and I think it's the ability to package based on the consumer needs and wants.
And what about marketing? And I have to say that your Instagram page, SA Tourism's Instagram page, it is spectacular. Some areas that I didn't even know exist in the country. But what's your advice to those people who are in the business of tourism and how they can market their businesses?
Yeah, look, again, the focus here for us as SA Tourism, as the sector opens up again, it's all about inclusivity. And we are really encouraging people to go off the beaten track, to go to those hidden gems, as it were, which have wide open spaces. We live in a beautiful country with great weather, but also very expansive as well. So people can travel far and wide. Don't go to the normal places that are quite squashed up with little ventilation, as it were. And again, I think it offers you an opportunity to do summer differently, I think, this year.
Mm-hmm. And to the traveler themselves, what is it that they should be taking into consideration?
Your health and safety is priority. I would choose to travel in a herd, as it were, with friends and families that are intimate with, and stick with them as well. Also, as well, it's all about choosing places that are open, have wide spaces, social distancing can actually occur. And really, again, going off the beaten track and choosing whatever it is that you fancy, but to always be mindful, wear your mask, sanitize all the time, and make sure that you can exercise social distancing.
Should we be traveling with thermometers?
I don't know, Eldrin, but I probably get my temperature taken 8 times a day on average, as I move from one place to the other. It's become the norm. And again, I mean, being self-aware is always important, but also just making sure that we can be safe as much as we can, practicing what we know. And it's all about the basics, and I think we can't overemphasize that.
Okay, just quickly, Sisa, before I let you go, earlier on this year as well, there were attempts, at least from the from government side, to try and help these businesses that are in distress. Do you think that anything of that sort will come around again?
I doubt it. I think whilst government acknowledges the responsibility of being able to support businesses that are in distress as a direct result of policy decisions, we just don't have the fiscus space in our fiscal environment to be able to support businesses across any sector, as it were. And that's unfortunately the situation that South Africa finds itself in. I think as a government, South Africa is trying to curb its expenditure. Hence, the announcements being made around, government wage bill, etc. So it's a really, really tight fiscal space that we just don't have the wiggle room in order to be able to support businesses. Besides the generic kind of incentives or rather initiatives that have been announced through through the banks around credit bank guarantees, as it were, to support business.
Mm-hmm. Any business-to-business ideas that you can share, perhaps?
Collaboration is key. The more you can collaborate with the tourism value chain, the better it is. What we are finding as well is that if you are just a hotel by yourself, you are selling a bed. But combined with activities in the area, with restaurants, and suddenly becomes an experience that you can package over 4 or 5 days that will be, suitable for the target audience you're looking at.
Okay, thank you so much, Sisa and Jonah there. We'll wait and see how those numbers look like and whether people are brave indeed to go around and travel. Also, while there is this risk of a second wave that could hit the country, look at what's currently happening in Nelson Mandela Bay as well as the Garden Route. So let's just quickly bring back Samgulesiwe Mthembu, who is a clinical psychologist. Samgulesiwe, just looking into people who would be traveling during this period and those who really do miss their family members. What advice would you give them?
I think just general is to sanitize, be cautious, and also don't be, in a sense, a hypochondriac. Every time you get a sniff or a cough, sometimes that over-anxiety can make you worry some more and actually lowers your immune system. Meanwhile, it is just a cough. So just follow up with your local doctor before you start panicking, because often people have panicked and thought that something is COVID when it isn't, and then, it leads to other things like panic attacks, stress, and just not being able to calm down in the family situation with friends, and which puts everybody on edge. So I think it's just to keep the information as accurate as possible and stay away from over-Googling symptoms, being a hypochondriac, and being obsessed with COVID symptoms.
And if you are that person who's prone to being anxious, what advice can you give somebody like that? Then just how do you get yourself into that festive season spirit?
So usually what happens with anxiety, or people who suffer from anxiety, is to just ground yourself. So if you are afraid that, let's say, for example, what we spoke about earlier on, that you are going to be that family member that infects a more sensitive or more older family member with COVID, then just sanitize. I mean, I've been in a room with a patient who had COVID, and I didn't know, but because I had a mask on, I sanitized often, even though I was in quite close contact with her, and we even used the same phone. I didn't get the COVID. So, there's a lot of things that people do actually have control over, and that's what they need to focus on, the control that they do have rather than the control that they don't. And then that will kind of alleviate some anxiety or some anxiety symptoms that people could be suffering with.
Yep. And thank you so much for your time. Really appreciate it. And I hope that that advice will help you enjoy the festive season. From me, Aldrin St-Pierre, and the rest of the Unfiltered team, it is goodbye. Enjoy the rest of your evening and also enjoy the festive season. And don't forget to wear your mask and also wash your hands. Bye-bye.